In the abnormal situation, there is an abnormal response, and this is absolutely normal. Things will get better with time.
Ladies and gentlemen, thank you for watching the show. I'm your host, Pranay Jared. Today, we're going to be talking about the coronavirus, COVID-19, but from the perspective of a doctor. Now, why are we doing this topic in this week? Well, on August 11th, it would have been 5 months since the World Health Organization announced that the coronavirus is a global pandemic. Now, 5 months, ladies and gentlemen, 5 months. 5 months is enough time for a man and a woman to fall in love, get married, and divorced. You can learn two things from that. One, relationships of this era are really unstable. Two, 5 months is a significant amount of time. And till this day, we are still learning about the coronavirus and so much more that we don't know. And as of right now, we have crossed 17 million cases worldwide. So yes, things are getting back to normal, but we still have to stay vigilant. We have many different news reports and news media, but whom of which can we actually trust? The news media nowadays is not that trustworthy, and we covered that topic in our previous episode. Do check it out. So I thought, why should we learn this from some other news source? Why not go directly to the source? So that is why we are talking with a doctor today, and he will tell us on what the coronavirus does to us, how it actually affects us, and how we can maybe even potentially tackle it. Let's see what the doctor has to advise us.
The expert we have on today is Dr. Manjeet Singh. He is a doctor and a research author. His research areas include direct or indirect effect of COVID-19 on epileptic children. His YouTube channel, The Medical Element, focuses on educating medicine in order to help understand life itself. He is an MBBS pre-final from PGIMS, Rohtak. He has various international publications, various research projects, a member of Society of Neurosciences, and a member of research in Child Health Society. So that's a bit about our expert today. Let's get on with the interview.
Dr. Manjeet, thank you so much for joining us today. I know you're a doctor, and in this pandemic time, a doctor would be pretty busy. So thank you for taking the time to being with us today.
Thank you, Purnam, for having me here and giving this opportunity with you all to speak up on this.
Well, sir, let me just say, I'm just a guy shooting a video, so I have to say thank you for being a doctor, for being in the front lines against this war on humanity, you can say, what the virus is doing with us right now. Speaking of doctors, and obviously you guys save lives every day, but you guys are doing a lot more, not just as doctors, but as other professions as well. Medical workers nowadays are doing a lot more in the fight against the pandemic. So take us through how that is.
I really feel blessed to be a part of this profession to which the whole of the human race is looking at, with the hope in their eyes. So first of all, I really feel blessed about that. Next thing is that it's a mutual responsibility from my side as a human, as a doctor. I have my responsibilities in a hospital for the patients which I am working for. But as a mutual responsibility as a human, it's also my part to share my information and the medical knowledge with other people so that the havoc situation of this disease that can be prevented.
We've actually had a conversation before about how doctors are not just treating patients or taking care of them, but also the different kinds of doctors and the different social outreach you guys are doing right now. So how is that going on?
Actually, the whole of the team of the doctors and the medical practitioners, they are working on a very broad spectrum. So some are on the front line, some are not on the front line, but they are also playing a very crucial role. So if you will see the initial levels, those who are not directly on the front line, like the researchers, those who are doing the research part of that, either developing of the vaccine. Then there are other group of doctors like the consultant level. They are preparing the protocol, the standardized protocol then that can be followed, because all the doctors are not the infectious disease specialists. So there are other specialized doctors. So we need to prepare a standard protocol for that. So those infectious specialists, they are making up this. And there are other group of the junior resident doctors. They are the one who are following the standard protocols and treating a patient. So then there are other group of doctors who are coming in the media, using the social media platform and disseminating this piece of information so that other patients who are the potential carriers or the potential patients, they can be prevented.
So then, of course, I want to know as a doctor what your experience has been like in this pandemic time, because this is a virus which is not known. So there is one thing being a doctor and treating someone of a known disease or a known virus. this pandemic hits. It's a virus which is nobody knows about it, and
Yeah.
we're still learning about it till this day. So, what did it feel like for you as a doctor mentally when you first heard, okay, I have to be the source of comfort for my patients, for treating them? What was going through in your head at that time?
See, Pranay, there is something what we call the allostatic phenomena. If you'll read about this, this says that in the abnormal situation, there is an abnormal response, and this is absolutely normal. So for us, it was a situation of chaos initially, because there was no standard treating protocols for us, for the doctors, those who are non-infectious specialist disease. So for these doctors, there were no standard protocols. So initially, when the patients were coming, so the symptomatic treatment was given for them. So after that, now we have the protocol and we know what kind of the treatment should be provided. Then there are ICU specialists, they are ventilating the patient. Actually, so it is the role of the doctors that we have distributed among us, and so we are doing on that part. If you speak on a perspective of doctors who are treating this, initially it wasn't that sorted out, but now when we have got in the middle of this pandemic, so yes, much more, some of the things have been sorted out, and things will get better with time. So the healthcare facilities, the treatment, the cure, all the standards, these will be get better with time.
I know it's been chaotic, not just for everybody. Even as a doctor, I think people forget to think in the situation that you guys are also human beings. But now that there's at least a bit protocol, rather something which we know better about the virus, there's still a lot of different symptoms. I hear symptoms ranging from no taste to diarrhea, people facing the virus. How much of it has been true in your experience?
Actually, this it is a spectrum. It's a mass spectrum actually. So firstly, there are the asymptomatic patients. We don't know how many asymptomatic patients are there, because the testing, the ample amount of testing that is to be done, that is not done because of the obvious reasons. Okay, so now come the patient whom we are the symptomatic. So in that we have divided, and out of that, as per the June records of the June, there are 81% of the people who are mild or moderate level. Their symptoms are mild to moderate, which I will explain this. But there are 14% who are in a very serious situation, and then there are 5% who are critical. Out of these 5%, there is a fatality rate of 2 to 3% of these critical patients. So talking of this, you need to know the basic etiology, how this virus affects. So there is a receptor known as ACE2, angiotensin converting enzyme 2 receptor, and is distributed across the body, from your brain to your respiratory pathway. Then you have your GIT pathway, or it's your reproductive parts. So everywhere, even in the testes, so this ACE2 receptor is there. So the whole this lining, when is impacted, so it depends on which organ the major causes we are looking for. So if it is impacting the GIT pathway, then the gastro part, so you will see the diarrhea. If it is impacting the lungs, you will see the pneumonia, especially the interstitial pneumonia that is found there. If it is affecting the brain, then you will get to know that it is the suffering from meningitis, and you will be surprised to know that if it is affecting the meninges, or it is causing the meningitis, then it nearly takes 72 hours to cause a fatality. In other patient whose testicular ACE2 receptor are impacted, it causes infertility in them. So it's a vast spectrum also, how it is affecting the patient's lives.
Just for a minute, sir. This is okay. To be honest, this is pretty new to me, because from what I understood or what I've read so far, the ACE2 receptors, yes, it's found across the body, but it's concentrated in the lungs and the heart. It's much more there, and it's especially high for people with cardiovascular diseases, or rather who are, stressed or hypertension. So why are these cases reported, and why is the pneumonia cases reported more?
Okay, and now getting to your question, is that ACE2 receptor, the virus need two of its initial to begin with. So first is the ACE2 receptor, and other critical part it need is the oxygen levels. So good oxygen level will have a good replication of the virus. So lungs are the perfect place, but other part, like from the nares, so there is a bone here from which the olfactory nerves come in into your nasal part. Okay, so there's a pathway. There are neurons getting into your nose. So from if it gets into your upper respiratory tract here, it can directly enter into the brain through this cribriform plate, and that can directly get into your brain. So this pathway is known as exoplasmic retrograde pathway. So there is for the neurons there is a myelin sheath is covered with. So it destabilizes that sheath and it goes through this. So there is loss of nasal senses, loss of the sense of smell also seen in some of the patients. So this is here to begin with. Then it may get into the lungs. Then it can get into the systemic, that is into the blood, and it can invade into the any tissue. And also I want to tell is that it is not a direct impact. It also causes the hypoxemia or the low level of the oxygen in the whole of the body. So those organs which are very much sensitive to the oxygen, so if there is any decrease in the level of oxygen, then obviously they will be impacted.
In order to cure the virus, if you don't breathe oxygen, it'll be okay.
And no, actually there is like a phenomena like if you have to make sure that the parasite is dead, you have to kill the host. So host obviously will die, then obviously the parasite will die. But this is not how we have to work. We have to
No,
be very much selective.
I'm just kidding around. I'm just kidding around. No, but that is actually something which seems pretty new to me, because the cases which are reported, or at least people who have died, they say that they've died because of pneumonia or other due to problems with lungs associated with the lungs. Dying due to meningitis has not been reported as much. Why do you think that is?
Actually, first cause is obviously that the number of the deaths are less due to the meningitis and other symptoms. But for the respiratory pathway, so obviously the cases are more, first thing. Second thing is that meningitis is called the systemic bacteremia. So when it comes to the systemic bacteremia, the spectrum of the diseases increases. So we are not in a stage to differentiate on the initial levels. Like when a patient comes in the first few hours, it is not possible for us to differentiate the patient from the bacteremia or the systemic bacteremia or the viral, or if it's SARS. In the meantime, there's a fatality and we sometimes lose the patient. So there is obviously less reporting of these central nervous system impact.
Okay, so that would mean that the virus in and of itself can be infected any part of your body. So then what about the asymptomatic cases then? Why are they asymptomatic is what I'm trying to ask.
Okay, asymptomatic is there because they have a perfect physiology when it comes to the respiratory pathway, because our respiratory pathway is covered with the endothelium. It's a layer of cell which cover whole of our tract. So when the first virus that attaches to that, it leads a perfect response. It just gets to the response for our to the immune system. This it gives a perfect signaling. Then now the signal pathway that we have, the immune system then comes up with the right type and the amount of cell and destroys the virus. So this is how we get the immunity of it. So once if you reach the immunized state, then you can be a carrier, but you cannot be a symptomatic patient of that. So if any patient who is symptomatic, it means there is any disruption in the physiology. Either ACE2 receptors have increased. This is known as upregulation of the receptors. This happens due to when a patient on a long term of the medicine of the diabetes mellitus, bronchial asthma. So in these cases, either due to the medicine or due to the etiology of the pathogenesis of the disease, there is increased number of these receptors. So the ample amount of the immune response is failed in the case of the symptomatic patients. But whereas in the asymptomatic patients, so it's a perfect response that the body is showing, and you get the better prognosis.
So just to point out for the viewers out there, can you explain it in simple terms of what exactly the ACE2 receptor does in our body?
Okay, ACE2 receptor, actually it is an enzyme. So there is a renin released by the kidneys. It turns into angiotensin 1, which is secreted from the liver. then it gets into the blood where it meets ACE2 receptors, where it get converted. So basically, it have a role in vasodilation and vasoconstriction to maintaining of the lumen, the diameter of the lumen of the blood vessels. So it directly impacts the blood pressure, because once the lumen of the blood vessels, if it is less, the blood pressure will obviously be high, and if it is dilated, then the blood pressure will be low. So it have a physiological role in that mechanism, ACE2 receptors. But in this case, these are present in lungs. So when this is impacted, this causes the interstitial fibrosis, or first it causes the interstitial pneumonia. So in this interstitial pneumonia, the lungs are not able to deliver the right amount of oxygen to the body. So this is how the disease starts.
Right. So I guess what you're saying is, for all the people with stress, please watch stand-up comedy and be less stressful. So that will solve the virus in and of itself. And of course, don't listen to me. That's just me kidding around. So, but then another thing I'd like to know is that, so you said it causes damage to neurons. It basically unmyelinates the myelin sheath, right? So
Yes.
we have severe neurological problems because of this. What do you think the extent of that could be?
Is there also the syndromes that we are looking for in that? So the whole of the epileptic and the seizure precipitates in this condition. So you either get the headache, nausea, vomiting. This is one of the first. So the other thing I want to firstly mention is the ARDS, acute respiratory distress syndrome. So what happens there is that the respiratory centers in the brain, they are impacted. So when these respiratory centers, which are located in the brain stem, so when these impacted, they leaves the signal, or they do not leave the signals. So there is physiological mismanagement of the lungs again. So what you will see here is that again the symptoms will again of the lungs, of the respiratory pathway, but it have impacted the brain. So but it have impacted the respiratory centers of the brain. So that when the respiratory centers of the brain, they are discarded, there is any dysregulation in that, so again you will see the symptoms out there. The other level of the symptoms can again be vomiting, or can be the diarrhea. These are again because the signals in the GIT pathway are again sent from the brain, but when there is any disruption, so again you will see the symptoms in the GIT. Now coming to the CNS itself effect, the first is the common is the headache, or the migrainous headache, which you will mostly see. Then the other is the seizures, or the epileptic episodes. So the whole of the electrical network in the brain, that gets disrupted after it.
So I guess this is a proper segue. This could be a proper segue into one of the research it is you're doing, conducting, or a part of right now. To see how this virus directly or indirectly affects children with epilepsy. So, do you think they're of higher risk, or what do you think the chances are with them?
Yes, yet now we were not looking up even in the researches which I was reading, or even in the patient. So the pediatric population who was suffering from COVID was not that much as compared to the older people, because obviously due to good immune response. But patients who are already having some CNS problems, but there is an issue with this. It can either directly impact the brain of the child, which I have told in the meningitis, but there are also it can indirectly impact. What I mean indirectly is due to the lockdowns, or due to this inavailability of the medicines or the critical care that these epileptic patients require. So when there is any absence of these, so the patient or the pediatric patient of the epilepsy, they cannot cope up with this. So what we need to make sure is that are they getting regular medication checkups, their examination, all is being done on the time. So what I was doing is that I was conducting this research. I mean, this was majorly focusing on their parent psychological issues of the patients of that, there is any difficulty, if there's any change in the quality of life. So the various scales I was using, one of them is like Kessler 10, K10, or the Kessler scale that we call. The other is the QLCE, that is the quality of life standards that we use. So is there any change due to the COVID breakdown and this pandemic situation? So this was one of my research which I am pursuing right now.
Wow, like I honestly think that that could be a new potential which we none of us have explored till now. And uh, honestly, good luck with that. So I hope that hope the news is good at the end of your research. And one final thing I'd like to ask is the patients who come who have been affected or have been admitted. What is their state of mind? Like I'm pretty sure once you realize you've been affected, you'll be like, oh my God, what's just going to happen to me? But I think most cases, most people do survive. That's the case, right?
Yes, exactly. I want to tell you one of the most interesting things that it is not only the patient who is admitted, it is impacted not by only by the COVID. It is their family, it is their near and dear ones that are impacted. Not by the virus, but the psychological issues. So they are also facing the psychological issues. Then there are people who are just fearing of the virus. Okay, they are having the phobia against this. But I think it's normal because everything is abnormal, and as I told, in abnormal situation, being abnormal is normal. So, but when it comes to a patient, so when they get into a hospital, I think they just get an assurance of yes, if they get into the right hand, they can be treated well. I think they should get this assurance first of all. So I think fatality rate is just 2 to 3%, that too in the cases of the old age or that. And the doctor, when he sees the patient, assess the profile, so he can just clearly make out what are the potential prognosis, what can be the result of this. So as per that, the treatment is started. So speaking from a patient's perspective, or the patients which I have talked with, so most of them were in the mild to moderate situation, and they were not that psychologically impacted because they knew it. They are the one who are facing it. But the person who used to, who are the family members, they are much more psychologically impacted, I think.
So I guess the thing is, I know it's easy for me or us to say that be calm. I haven't been in the experiences, but try to stay calm and be positive. And one thing I would like to ask is like, what information are you privy to? Because you're a doctor in that field. Are there any drugs which actually can, improve the state of health, which are in the market available right now, which is recommended, of course?
Yeah, this is something that every person must know about. And the first and the foremost thing they should know is that do not follow the false piece of information and the curative promise that are being made in the market. So please don't follow up with that. All you need to do is just to take care of your body. You need to eat fresh, you need to boost up your immunity. So whatever the vegetarian diet, just follow with the vegetarian diet. Don't go for the fast foods most of the time. So just follow with raw vegetables. Don't get the vegetables go through your kitchen, because that destroys most of the proteins actually. So if it is utilize the raw fresh foods which are seasonally, which are available in that. So these are the very small few things that can be done. You can use vitamin levels, vitamins that are available in the market, but I personally will suggest that it is good if you are using the raw vegetables and fruits. And the second thing I want to make out is that there are prescriptions that was circulated on the social media about hydroxychloroquine and other. So these are the drugs that can only be used in the ventilator settings, or the settings which we have the emergency all set up, all that. So please don't use at your home. Don't use any other spectrum of drugs, because I have seen people are getting mad over HCQs, or the ivermectin is there. So some people were, I got to know that they are taking 3 mg weekly ivermectin. So please do not self-medicate yourself. All you need to do is just boost up your immunity, and that can be done you eating up the vegetable and fruits, a light amount of exercise at your own home or the terrace, wherever you feel comfortable, rather than going in public places and doing. So just be at your home, and just keep exercising regularly. Just a light amount of exercise would be enough.
Well, I think that's the doctor's advice, ladies and gentlemen. That's nothing more for me to say. That's the doctor's advice. So, do you have any one last word you want to say to the viewers or the audience about, how to go through this pandemic times?
Uh, uh, yeah, all I want to say is that please take care of your psychological and mental health. That is much more important, because when I was talking to the people of other fields as well, they were saying that jobs are getting down. We are having other situation that we were not even in life were ready to face off, either when whether it's their children's education, whether for their children's to staying at home, not meeting up the friends for the longer time. So these are the very small things, but you need to sort them out. You need to take care of your mental health. You need to make sure that yes, you are safe, you are following that social distancing kind of, and washing up your hands, not touching your face and eyes with your hands. So these are very small but very crucial and critical steps which you can take up. And next thing I want to tell about is that please do not circulate or do not help the fake news to grow up. So because there is so much of fake and the false news being circulated on the social media, please don't do that, because not for you but for someone else this is really dangerous, I would say.
Well, there you heard it. Dr. Manjeet, thank you so much for joining us. Thank you so much for doing this. I personally would like to say that this is really informative. I'm pretty sure the viewers will agree with me. So thank you for being on the show.
Thank you, Parna, for being me here. And it is always nice to interact with you and talk on all the aspects on all the major that we chat upon. So I hope people will get a small but a very crucial message. And please keep up following with your doctors, with your administration. They are working for your betterment. So that's the last thing I have to say. That's all for now. Thank you.
Thank you, sir. Thank you so much. Now that concludes the interview. Now I would personally like to take one moment to thank all the doctors, the nurses, the medical healthcare workers who put their lives for us day in and day out. The virus is the enemy and they are the army fighting for us on the front lines day in and day out. Thank you so much for doing this. We can help them by staying vigilant and by being safe. And of course, for the people who watch this video, following what Dr. Manjeet said. I hope this video is informative and was helpful for you. And if you did like the video, please do like, share and subscribe. That would help us. And if you didn't like the video, please do like, share and subscribe. Because hey, it's free. Thank you for watching.